Hello everybody, welcome. My name is Peter Douglas and I'm the CEO and Managing Director of IPAF. I'm delighted to announce we've over 500 people registered for this webinar, representing over 35 different countries, which is amazing, so thank you for your support. I will run through a brief overview of IPAF's main activities before handing over to Chris, who will take you through our COVID-19 safe operating guidance using MEWPs, mast climbing work platforms and hoists. A copy of this presentation, along with the guidance document and a link to the video of this webinar, will be saved on our website and available to download free of charge after this event. The guidance document is available in 7 different languages. After we have run through the guidance document, time permitting, there will be a short Q&A. To ask questions, please type your questions into the Q&A tab and we will try and answer as many as we can. IPAF, or the International Powered Access Federation, our overarching objective is to promote the safe and effective use of powered access worldwide. And we do this in a number of ways, which I will explain in the coming slides. IPAF is a not-for-profit membership organisation and was established in the UK in 1983, some 37 years ago. IPAF has well over 1,400 members in 72 different countries. The membership is made up from rental companies, MEWP manufacturers, training companies, suppliers to the powered access industry, contractors and users of the equipment. Our manufacturer members are responsible for around 90% of all powered access equipment on the planet. We have regular safety campaigns to help reduce accidents and incidents in the industry. We've created Andy Access. We use Andy to get simple safety messages across to users of the equipment through posters. Each poster comes with an accompanying toolbox talk and are all available in our core languages as free downloads on our website. We have a big focus on influencing and interpreting legislation and standards around the world. We've recently been involved in the new ANSI standards in the US. We were involved in ISO 21455, the standardisation of MEWP controls, which has been recently published, EN 280 standards, as well as many others. We've also been collecting accident statistics from our members since 2012. Most of the safety campaigns, toolbox talks and activities we get involved in are based on this accident data. This helps shape improvements and allows us to focus on reducing accidents in common problem areas. We produce lots of practical guidance documents, including the one you're about to hear about. All of our technical guidance can be found on the Tools and Resources section in our website. We produce several publications, including our recently published MEWP Worldwide Safety Report. This report is based on 3 years of accident data that we've collected on fatalities and accidents and incidents. We also publish annually our IPAF magazine, the IPAF Journal, Elevating Safety. These publications reach many hundreds of thousands of people each year and spread IPAF safety messages. And in conjunction with our partners, Ducker Research, we publish an annual global rental market report. This provides invaluable insights, information and forecasts in each of our major markets. This is a useful report for both rental companies and manufacturers worldwide. Our training programs are renowned worldwide as a high quality level of training and in many countries are the default standard. We have a comprehensive range of courses and we train in 21 different languages across the world. Training is available through our member network of over 750 training centre companies. The PAL card, or Powered Access Licence, is recognised worldwide as proof of platform operator training to the highest standard. Our members trained over 175,000 people last year, and there are now over 800,000 active PAL cards worldwide. Thank you very much from me. I will now hand over to Chris to run through our latest guidance.
Thank you, Peter, and welcome everybody. Good afternoon, and welcome to this webinar about working with MEWPs, mast climbers and hoists safely during this COVID-19 epidemic. A bit about me, for those who don't know me. I've been in the access industry some 40 odd years and started off as a delivery driver, delivering, collecting and operating predominantly scissor lifts and booms and vehicle mounted MEWPs, mobile elevated work platforms. I then became interested in a bit more in health and safety and became an instructor, an IPAF instructor, delivering training and helping people use these machines safely. That interest in health and safety took me into doing some exams and gaining a degree in health, safety and environmental management in the ripe old year of 50. So from there, that enabled me to take up a position with one of the UK's largest rental companies as their health and safety manager. And that was a position I held for several years until I joined IPAF as their technical and safety executive back in 2011. And just recently, I've left IPAF and formed my own consultancy company offering advice, health and safety advice to the access industry. But that's enough about me. Let's get on with the webinar. But I think it's worthwhile, before I do start talking about the webinar, we just remind you of a couple of points. This guidance that you're going to hear today and the guidance that that IPAF have published provides practical advice and safety measures to minimise exposure to COVID-19 for anyone specifically planning to use MEWPs, mast climbers or hoists. The measures discussed are intended to complement and add to existing workplace risk assessments and control measures that should have been in place or should be in place for these pieces of access equipment prior to the epidemic or the pandemic developing. They're not intended to provide advice on general workplace. It also assumes, the guidance that you're going to hear also assumes, that sites should have existing COVID-19 safety precautions in place. Many of the pieces of access equipment will be used in factories, on construction sites, in lots of other places, and those workplaces should have their COVID-19 safety precautions in place. And finally, the information you're going to hear today is based on current guidance and recognised standards, but it also recognises that this pandemic is a progressing thing and goes through different stages. And the current state of development, there is the present guidance we've based the webinar on. But over time, that may change as the situation develops and hopefully easing of more and more restrictions happens. So Peter mentioned the guidance document, and here it is. The webinar will reflect and complement IPAF's guidance document. It may vary slightly in the odd place, but it's basically based on the guidance, which can be downloaded from the IPAF website. So what are we going to talk about today? Firstly, I'm going to talk about risk assessment and look at what needs to be in place and what steps and stages we need to go through to do a full and proper risk assessment. Once we've done the risk assessment, we're going to look at the hierarchy of control, what measures we put in place and what are the best measures and the hierarchy we need to follow. I'll then look at behaviours and how they influence us and how they are very important in helping us control this pandemic. I'm then going to look at 3 activities that we need to concentrate on, and that is inspection and maintenance, cleaning and emergency planning. And then finally, I'll look at on-site training. So let's get on with the webinar. Risk assessment, and I make no apologies here for actually going back to basics. I believe a lot of people ban the word of risk assessment about and don't really understand what it means, but I want to take it back to basics and provide you with some clear steps of what you should be doing and what is expected when we do a risk assessment to assess this COVID-19 pandemic. And first of all, it's identifying that hazard. What is the hazard? Some people call it coronavirus, some people call it COVID-19. Is that the same thing? Well, Coronaviruses are a family of viruses that generally cause diseases in animals, but they can mutate into humans. And in the last 20 years, there's been 3 cases now where that has happened. In 2002-3, we heard of SARS, or SARS developed, severe acute respiratory syndrome. And that pandemic focused mainly on Asia. And when you look at the figures for that, there was 8,000 confirmed cases. And unfortunately, there was a mortality rate of 10%. So 800 people out of those 8,000 lost their lives. And then in 2012, we discovered Middle East Respiratory Syndrome, or MERS. And MERS is still ongoing today, predominantly in the Middle East, and there have been 2,500 cases. But when you look at the number of people who have died from that, 30% or more, 36%, 1/3 of people who contract MERS actually die from the disease. And now, in the current time, we've got what it's technically called is SARS-2, Severe Acute Respiratory Syndrome Coronavirus 2. But the World Health Organization decided that that may cause confusion with SARS and cause a bit of panic, especially in the Asia part of the world. So it was renamed as Coronavirus Disease 2019, because that's when it first emerged. So it's known as COVID-19. And when we look at COVID-19, as of the World Health Organization this morning, their website, there have been confirmed cases of 4.8 million cases. And sadly and drastically, more than 319,000 people have lost their lives. So why is this pandemic, why is COVID-19 more serious, or why has it spread more than the others? The other COVID viruses that have mutated to humans. And there's 3 key factors around COVID-19. The first is COVID-19 can be asymptomatic. And asymptomatic means a person can have the virus and be unaware, not show symptoms. So they can be wandering around, they can be in the workplace, and they can be spreading the virus without even being aware of it. The second thing to be aware of is COVID-19 has a pre-symptomatic stage as well. So somebody can be infected with the virus, and for a period of approximately 7 days, they will show no signs of the virus. They will be in a pre-symptomatic stage. But in that stage, they can be highly contagious and they can pass the virus on to others. And then the third thing is 80% of people who contract COVID-19 only suffer from get a mild infection. But the other 20%, it can be fatal, as we can see from the numbers. So the difference is COVID-19 has spread far greater because there's this stage when it may be undetected, whereas SARS and MERS, when people contracted that, they were seriously ill and they didn't have these earlier stages. So that is why we've got this severe pandemic from COVID-19. So how is it transmitted? Well, if you look at the picture there, it's a fairly graphic picture of somebody coughing, and you can see all the water droplets that come out of the mouth when someone coughs. But the water droplets don't only come out of someone's mouth when they cough, they come out when people are speaking, as I am now, or when somebody sneezes. And COVID-19 is mainly transmitted through these droplets being generated when an infected person coughs, sneezes, or speaks. And these droplets drop to the ground or onto the floor or onto surfaces where they lay for a while. So you can be infected as an individual by breathing in the virus droplets. So if you're stood within 1 meter of a person, an infected person, and they're just speaking to you, there's the significant risk. If they sneeze, well, the droplets can travel way more than 1 meter. And the other way to be contaminated or infected is by touching contaminated surfaces. And this is the key bit, then touching your eyes, your nose, or your mouth before you wash your hands. Coronavirus doesn't transmit through the skin, it transmits in through the eyes, the nose and the mouth. So it is key to remember that washing of the hands is vitally important in this. So the virus may persist on differing surfaces. Once someone's coughed, sneezed, well, these droplets that have dropped wherever they've dropped, they can drop there and they can live there for a few hours or for several days. So in the workplace, in the home, they can lie there for quite a number of time. How long? Well, some recent research identified that coronavirus was present on cardboard 24 hours after it was put on it, wood, it lasts for 2 days, paper 4 days, and plastic and steel between 3 and 7 days. The thing about that research says the virus was present on plastic and wood 3 to 7 days later, but it can't confirm how virulent it was and how contagious it was at the end of that period. But it is there. So you have to bear in mind that when we put in these control measures. So it can live on your telephone. Imagine someone sneezed into their hand and they touch a handle and then someone else is touching it. You can see quite easily how it spreads. And you can see how dangerous it can be. But what we are concerned with today is concentrating on who might be harmed and how they might be harmed with using access equipment, MEWPs, mast climbers and hoists. And if you think about them, well, they're covered in a lot of plastic. There's plastic parts, components and metal. So there's this risk may endure for a significant length of time. So in deciding who may be harmed and how they may be harmed, we've actually got to look at 2 key areas. Most of the equipment that's used out there is rented in. There are, I admit, people or factories and organizations that have their own equipment, but the majority of access platforms, mast climbers and hoists are hired in equipment. And so there's a process from the start to the finish of using those that we have to consider and identify who may be harmed. Even as simple as the ordering of a MEWP or an access platform. Some companies request a site survey. They don't know what machine it is, so they request a site survey. So that puts at risk the user and the members of the rental company. The delivery and the installation of that access equipment, that work platform, can involve the delivery person, so the rental company, and the site it is being delivered to. And then such a simple activity as familiarization, that can affect both the user and the representative of the rental company who's doing it. And then the actual use of the machine, and that is down solely to the company who's using the machine and their employees. And then there's maintenance. If the machine needs an inspection or servicing or breaking down, the rental company will have to come and repair it or look at it, inspect it. And again, there's this risk of an interaction between the user and the rental company. And finally, the rental company comes to collect it at the end of the day. So there is a significant risk of infection at any of all those stages of the rental process. So now you've identified how and who can be affected or who is at risk, we evaluate that risk. And when you think of evaluating that risk, at the present time, with the asymptomatic and the pre-symptomatic stages, we could near enough all be at risk if we interact with other people. And although 80% of cases are not serious, there is evidence that if you contract coronavirus or COVID-19, there is a risk, or a significant risk of it taking your life. So the risk is high, and we have to apply the most effective controls that we can. And that is by using the recognized international hierarchy of control. And first of all, the first in that hierarchy is, if we've got a hazard, let's eliminate it. Let's eliminate the risk. But we can't eliminate this hazard of COVID-19. We haven't yet got a vaccine that eradicates it. So we've got to manage our control measures to try and reduce the risk or isolate the risk, control the risk, and using PPE as a last resort. It's interesting when you go to lots of places, there's been a lot of talk about PPE, But PPE, we have to remember, is the last resort in this hierarchy. There are lots of other effective measures that can be put in place prior to considering PPE, although PPE does play an essential part, as we'll find out later. The other thing we have to remember about evaluating the risk and deciding on the precautions is normal health and safety requirements for the activity must not be compromised. So we may bring in new measures to control COVID-19, but they must dovetail in to existing control measures for the safe use of MEWPs, mast climbers and hoists. And at the end of the day, you've got to consider if an activity can't be undertaken safely, then it shouldn't take place. So we're now going to use the hierarchy. We know what hierarchy we're going to use. Step 4 in this risk assessment process is documenting your findings, and putting it down helps easier to understand it, and then starting to implement your precautions. And whatever precautions you implement, you need to communicate to your workforce, and don't expect them to turn up at work and then communicate it then. There may need to be advanced warning of that communication, of what they need to know and what measures are in place and how you're going to implement them. But it's not only communicating with your own workforce or the operator of the piece of powered access. It's about coordinating and incorporating your actions, your precautions, your measures that you're going to implement with the rental company, with the site you're going to work on, and with the transport people bringing and collecting, with other workers around that site as well. So it is a matter of everybody coordinating and cooperating together. After all, we're all in this together, and only by working together can we conquer this pandemic. And part of that cooperating is giving frequent reminders of the controls. Introducing controls and new measures is change, and a lot of people don't accept change or take change all that easily, or they slip back into bad habits. So frequent reminders of the controls is essential, and that may be as simple as just going around the site and talking to the employees or the workers or other people in the workplace on a regular basis. And then, while you're walking around as well, complete those compliance checks to make sure people are complying. And where they're not complying, try and understand and ask them why we're not following the rules. Is it too difficult or whatever? And that takes us on to stage 5, which is this: review and update your plans as necessary. You can see the cycle there. It's a well-known cycle for international standards of plan, do, check and act. Well, we're getting to the stage where you've done the risk assessment, you've put the plans into place, you've checked to see if they're working. You're now going to act to make sure that it suits everybody. So consult with and communicate with all interested parties. Again, the site you're working on, the rental company you're working with, other people who are working on the site. Do your measures that you want to implement interfere with theirs? Do theirs interfere with yours? Is there problems? And if you can understand where there are problems, you can then start to make improvements to make sure the measures are the best they possibly can be. But you've also got to monitor and review current advice. As we say, this pandemic is a shifting feast and it's changing all the time. So we need to understand the changes in advice. And we also need to monitor people's health. If people start falling ill at work, well, then we need to take some back steps. We may need to rein back in some of those controls and make them tighter, just as the government will do if we see a spike in the pandemic in certain areas. And then once we've done all this review, we can adapt our work methods to the changing situations or the requirements that we've identified. Doing a risk assessment isn't about doing it once and putting it on a piece of paper and sticking it on a shelf. It is about continually monitoring the situation and adapting to it as things progress. So that's enough about risk assessment. Let's now talk about applying this hierarchy of control. And if you think back down to the lockdowns where we've been around the world, as Peter said, there's 35 different countries, people from 35 different countries joined us. And 35 probably different governments have put in their own lockdown rules. And they follow this kind of hierarchy of eliminate, reduce, isolate, control and PPE. They can't eliminate, they haven't got the vaccine, although they're trying to work on it. So they've said, stay at home, eliminate the risk. If you stay in your own environment, you can't spread it. Reduce the risk by limiting time people go into public areas. And isolate people who have got the disease, but also I limit numbers into going into shops or different places, into workplaces, so we can isolate people so we don't come spread the disease again. And then controls the governments have implemented through social distancing and the need to wash your hands and sanitize equipment and workplaces. And then finally, PPE and gloves and masks. And the other measure that the governments have brought in as well is discipline, and they've introduced fines as well. It's not a kind of a route we would like to take, but it is an option at the end of the day in the workplace. If all the other hierarchy are failing, there is kind of the disciplinary route, although we don't want to go down there at all if we can. And just there's a little bit there called the ERIC PD. When I was doing my studies, the simple way I remembered the hierarchy of control was this ERIC PD, which was eliminate, reduce, isolate, control, PPE, and then finally discipline if we needed it. But that's enough of college work and one thing or another. We are now seeing a gradually lifting of the lockdown, and governments are encouraging those who cannot work from home to go back to work. And those workplaces where they're going, having to follow government guidelines. So the first in the hierarchy was eliminate. And as we've said, we haven't got a virus, we haven't got a vaccine, so we can't eliminate it that way. So the first step we need to do is ask, is the task really necessary? Must it involve a MEWP, a mast climber or a hoist? And many tasks out there are necessary because construction, the health service, the building of emergency hospitals, food production, lots of other companies and organisations have had to continue through working and help us get through this this pandemic. And so there are many places where it may be necessary to do certain tasks. Must it involve a MEWP, mast climber or hoist? Well, you've got to consider there, if you don't use one of these pieces of equipment to work at height, how are you going to work at height? Don't go and choose something which is going to increase the risk just for the sake of not using a MEWP, mast climber or hoist. But you still have to ask the question. And then if those answer to those two questions is yes, we must do the task, and yes, it will involve a mast climber, a MEWP or a hoist, make sure everybody understands that if they're showing symptoms, they're suspected contact with an infected person, or they actually are a vulnerable person who's at risk with underlying health problems, they should be not coming to work, they should be staying at home. And that is one of the best ways to eliminate the risk of COVID-19. So we can't eliminate it. We've identified we've got to come to work, we've got to use this piece of powered access equipment. How do we reduce that risk? Because we're coming down the hierarchy. First and foremost, you should consider the selection of your service provider. Who are you going to get this piece of access equipment from? And what are their measures for preparing that equipment before it actually comes to your site, before your workers climb on it? What about the delivery of it? What about the installation of it? What about the on-site maintenance? And what about the collection procedures? Just as you do pre-qualifying questionnaires to select a suitable service provider for other things, and normally for MEWPs as well, you should be asking your service providers, do they have in place safe transport and safe maintenance practices? And they should be able to show you some kind of safe system of work or method statement of how they ensure their drivers can deliver and collect these pieces of work equipment, and how their service technicians can do pre-delivery inspections, install them, on-site maintenance or post-hire inspections safely, and reduce the risk of cross-contamination infection to yourself. So the first step is talk to your service provider, work with them, make sure they've got all these key measures in place. So then once you're satisfied with their measures, and their measures fitting with yours, and their measures fitting with the sites as well, we can then consider actually using this piece of equipment. And if using, how do we reduce the risk if we have to use a hoist or a mast climber. We'll start to look at minimising the participants, lower the hoist capacity and increase ventilation. It is proven that outdoors there is less risk of the spread of the virus, so increased ventilation will help with that as well. And what about using mobile elevated work platforms? Consider the number and the length of time you have these access platforms on site. Quite often there's a number of the number of access platforms on the site. You see quite a lot of them sat doing nothing or underutilized, and they're there for quite a length of time. If you can restrict the number and the length of time they're on site, you're reducing the risk. Minimize the participants who use the platform. Increase the platform size and consider material handling attachments. Material handling attachments such as the ones shown there can help keep people apart, but keep workers apart, but it can also reduce the number of people that are needed in the platform. But the key way to reduce the risk is to remember to regularly wash, sanitize your hands before and after using a work platform or working on a work platform, and ensure social distancing of at least 2 meters. Those are key methods of reducing the risk of infection. So then we move down this hierarchy to isolate. So how can we isolate? Well, think about the delivery and collection point of this piece of work equipment. Do you want the delivery driver coming onto site and then dropping it off the machine and driving it halfway across the site? Or do you have an isolated, a dedicated delivery and collection point where the driver can drop it off under a controlled conditions? He's not mixing with the rest of the site. There aren't people going over and talking to him and touching his truck or the machining advance. There's lots of things that can be done by isolating and identifying a dedicated delivery and collection point, and making sure when you finish using the machine, you put it in that delivery, that collection point, ready for collection. Another way of isolating is to make sure you dedicate one driver to one machine or one operator to one machine. And don't, as the image shows, put all these machines close together. Start to keep them safe distances from each other so people are not tempted to touch each other's machines. If you have one dedicated machine with one dedicated operator and it has a dedicated area where it works, you're starting to isolate that machine and reduce the risk of contamination and infection. And with work platforms, mast climbers, where you have to work in teams, keep that same team together. Get that team to work as a team, but keep them as a team. Don't start interchanging between team members. If you can keep the team together, then if at all you have any issues, you know who is potentially infected, and you can manage that and keep a note of who those teams are, and whether it's an access platform or a hoist or a mast climber. Remember, use your own tools and equipment. The less you have to swap equipment, the less you have to swap tools, you reduce the risk. And then again, we move further down this hierarchy to the control measures, markings and signage. And there's just a couple of examples here. The example there of an extended deck of a scissor lift with some tape, simple as that, 2 meters apart to remind people to stay at social distancing. And you can put signs of it. Do not share this machine, or clearly clean it regularly. Don't switch drivers, and clean all touch points. There's many, many ways you can do it. And remember, you've got to sanitize these regular touch points, and not just thinking about the access platform, but if it has a cab and a driving position as well, there's lots of areas where you need to touch it. If it has a side door, that may need cleaning as well. And deliver regular briefings. As we've said, putting new control measures in, you need to communicate this. So you need to do these briefings to bring the workforce with you. And to get them aware of the change. Increase the supervision, as we've already talked about. And one of the ways of doing it is if you've got a significant number of people working on powered access, stagger their breaks and stagger their start and finish times. So they're not all working together and they're not tempted to break the 2 meter social distancing guidance. Where the work demands that the social distancing of 2 meters cannot be applied, what do we do then? Well, we have to control that. And first of all, that would be asked, is this task essential? Can it be delayed? Can it be put off till later in the work programme? Can it be done another way? Can it be done by one person? If the task is essential and can't be delayed or can't be done other ways, then we have to implement other measures. Minimise the frequency and time of the task where possible. Limit close working to 15 minutes or less. And try and plan to get the site workers to work side by side. Avoid this face-to-face contact situations where there's this risk of these particles cross-contaminating people. And separate teams from each other. If you have a team that have to work closer than 2 meters, keep them as a team and separate from them from the other teams. Remember this asymptomatic and pre-symptomatic situation. You need to control it as much as possible. And consider using permits and checklists to make sure you are implementing the extra measures for these people who are working less than 2 meters. And of course, we then come to the thorny question of PPE. And PPE may be required, and you may deem it is required for those who work closer than 2 meters. You may deem it is required for people who work further than 2 meters away. And I'm sure we could dedicate a whole webinar just to talking about PPE. But what PPE should we use? There are lots of options out there, but that again depends on your workplace, your risks, and your work activities. But you've got to remember, this disease is transmitted by getting infected droplets, either inhaling them or getting them on your hands from touching surfaces and then touching your eyes, your nose, or your mouth. So you pick the appropriate PPE for that. Looking at masks, there's a lot of talk around masks. And one of the things you have to realize is these masks are filtered face pieces, as they're called, FFPs. There is different grades of FFPs. FFP2 is the minimum you should be using to be effective. And in the USA, that's equivalent to an N95. But any respiratory protective equipment should not be shared. It should be, if it is designed for reuse, it should be sanitized before and after use, and you should be the only one using that. If it's disposable, immediately after use, it should be disposed of in the waste. But what we also have to remember with any PPE that you're going to introduce is its suitability and compatibility. Going back to face masks, there's unvented, there's vented. So some that are vented help you breathe and expel air and stop droplets coming in, but also they can help when you've got eye protection on, such as the goggles, stop them misting up. There was nothing worse than mandating that somebody wears the goggles and a face mask, and then you're asking them to operate 20, 30, 40, 50 feet up in the air, and their goggles start to mist up. So make sure whatever PPE you recommend or insist on and can get your hands on, availability is a big issue too, is suitable and compatible. But down to even basic PPE like harnesses. You should have your own harness, you should have your own lanyard. Operators should have their own harness and lanyard. And other PPE as well. Don't share it. Sharing these things increases the risk. Make sure you store it in a clean place and try and keep separate the dirty PPE and your clean normal clothes. At this point, I just kind of remember when I used to do painting, or when I paint, I may have gloves on and a paintbrush, but at the end of the day, I end up having paint all over my face, over my clothes. The wife even makes me change my clothes before I come in the house, and she doesn't get to lean against anything because bits of paint get everywhere. And that's a visible hazard. We are dealing with something that is invisible. So how do we manage it? We manage it by using the hierarchy, and this last in the hierarchy, PPE, but even when we're using PPE, put these measures in place. Try and store clean and separate different. Consider wearing disposable gloves, especially when you're putting your PPE on, and when you've taken your PPE off, take the gloves off. Provides hand sanitizer and wipes is a must, and clean PPE regularly, just as cleaning all the other equipment. So that's the hierarchy and how we can manage some of the risks. Let's move on to behaviours. Behaviours are influenced by attitudes and values. And what we have to remember is that people's attitudes and values have been changed significantly during this pandemic. There may be a lot of people out there who have been kind of confined and in lockdown for a number of weeks, and are just pleased to get out there and see their friends, see their workmates, and get back to work. And going, the changes, the 2 metre social distancing just slips out of their mind. There may be people who think, well, this only happens to older people with kind of underlying health problems. And so they're blasé, or they're not bothered. They don't follow the guidance. It's not for me because I'm not going to get it much. 80% of people don't have serious issues. So you've got to combat that complacency and make sure you deal with it. And one way of dealing with it is with having briefings and toolbox talks, but remembering this social distancing. IPAF has got guidance on toolbox talks, and there's lots of different toolbox talks out there, but they have a document how to deliver an effective toolbox talk, which is downloadable from the website, which may be worth referring to. But involve your workforce in the decision making during these toolbox talks, during these gatherings. Don't just make it a one-way system where you're passing information to them. Get them to give their information and understand their situation, their concerns, and work together to get safe outcomes. And as we've already said, collaborate with other teams on site, other workers, other trades using different equipment. Come back, collaborate with your rental company, the site owners, and encourage this open discussion and this sharing, and reiterate the key requirements to everybody. And part of this collaboration as well is considering people's mental health. It's a key issue that's happening during this pandemic that needs to be managed as well. So what about cleaning? Well, stringent cleaning procedures should be in place throughout the workplace anyway. They should be existing, but you should also be working to consider cleaning your work platform, your work equipment. And what you're going to clean it with. If you're going to use detergents, are you aware of what the detergents are? Make sure you download the material safety data sheets for the detergents you're going to use, the new cleaning products you're going to do, and do some kind of assessment and make a simple note of its intended use, what the hazards are, the storage, the first aid measures, and any PPE that's required for people using it. And also don't forget the hire company where you're getting the machine from. Their cleaning procedures are just as important as your own cleaning procedures. Cleaning the machines, cleaning these access platforms, machine controls, entry exit points, touch points, guardrails, wherever you've touched, wherever it gets touched during the working day should be cleaned, and not just at the beginning or the end of the working day. If people more than one person in the platform or at different after breaks, consider all those points. And don't forget the ancillary equipment, the charging leads, the charging boxes, the transformer boxes, tools and equipment. They all need cleaning. And don't forget to clean your own hands as an operator as well. And increase the frequency of waste removal. A tidy platform is a platform that doesn't have areas that can be contaminated. You're reducing the risk by keeping the weight and removing the waste. So just general good hygiene practices can help us along the way. What about inspection and maintenance? Well, pre-use inspection has always been very, very important. Before you use a machine, it's critical that you make sure it is safe to use. It's a requirement, your requirement as an operator, to make sure it's safe to use. But a lot of these machines will have probably been stood on site while a workplace has been closed down, will have been stood for quite a significant amount of time. Certain inspection requirements may have expired, so you've got to doubly sure when you do your pre-use checks that you're checking, does it require another inspection? What other issues may there be? So it may be that you have to contact your supplier and get in touch with them and get them to come and help with some of these inspections, especially if they've been stood for a long while. But also, how do you manage defects? And what about the rental company? if they've put limited staffing, there may be limited people, limited resources available to come and fix and repair these machines. You've got to bear all that in mind and build that in as part of the plan. And statutory inspections, periodic inspections, depends on where you are in the world. It may be 3 months, 6 months, it may be annually, but there is a statutory requirement to inspect these machines to make sure they're safe. In the UK, the Health and Safety Executive issued guidance on the legislation which is required here for thorough examination. They issued guidance on the lifting operation, lifting equipment regulations, which is freely downloadable on the HSE website. And what it says is the user is responsible to ensure that machine is safe. And the best way of ensuring that machine is safe is still to plan to do those inspections and those maintenance checks. And to do that, workers may not be on site, but if this machine's there, make provisions to allow the service technicians to come to site. And when they do come to site, you have to put measures in place to make sure they're safe and protected, and they're not put at unnecessary risk. So try to plan to continue to do the inspections. If you can't do the inspections, you should consider not using the machine, but you should also weigh up that you're confident that this machine is safe to use at all times, because safety is critical. So when the machine's provider, the rental company, comes to inspect the machine, there's certain information you need to pass on in advance. You need to add communication before they get to site about the availability of the equipment, where it will be, any specific site rules, how to access the site, and contact information as well. There's lots that needs to be taken into account before the engineer or the service technician gets to site. And when they do arrive on site, provide them with a secure area. So limit where other people can come, restricted area, they can work in a safe area. And it's not just to prevent other people, traffic passing by, but it is also to stop cross-contamination as well. Make sure you supply hand sanitizing or washing facilities very close by, and brief the service technician or the engineer on the routes to get to the facilities, and keep an eye on his welfare. Make sure he's okay, and make sure he's not putting your people at risk, and you're not putting him at risk. And talking of risk, let's talk about emergency planning. If someone's working at height, there is a requirement to have a rescue plan. But don't assume the old rescue plan you had pre the pandemic is good now. You may not have the ground person that was there identified before. You may need to train up new ground rescue persons to be able to operate the ground controls if there is an issue with you being stuck up in the air or being problems in the air. And what about the current contact information in case of breakdown, in case of emergency? That might have changed. Circumstances have changed. At least as a minimum, review your rescue plan and consider the rescue person and the current contact information. But there may be other things you need to do with regards to COVID-19 precautions. If you're going to be doing a high risk activity which involves using very sharp cutting tools or chemicals or welding or even electrical equipment, if those are high risk activities, ask yourself, can they be avoided? And if they can't be avoided, is your integral first aid team, your emergency team, well prepared? Are they aware of the risks? What about the issues? Make sure there's extra hand sanitizer there and face masks. In all the guidance you hear, they do actually say that if someone is seriously injured and needs first aid, you can break the 2 meter rule, but take all the precautions you can with face masks, with using hand sanitizer before and afterwards, and plan for sufficient delays, because emergency services may not just be on hand just like that. This is a changing world. We are in a different circumstances to where we were late last year. And one of the things to be aware of are the COVID-19 symptoms. Familiarise yourself with them. First aid workers should familiarise themselves with them so they can be aware and assess and understand if someone is suffering from potentially suffering from coronavirus, or if it is just other symptoms. And finally, IPAF training. IPAF have issued guidance just like they have for the safe use. They've issued guidance to training centres around how they can comply and reduce the risk of COVID-19 in training centres. One of the best ways of doing that is to do the theory online, and more people are starting to do that. And I would recommend, if you're going to do training, you actually contact your training centre, do it online theory, and then go to a dedicated training centre to do it, where they're rigged up and they've got specific guidance and there aren't other issues which may interfere or introduce other risks. But if you choose to undertake the training on site, then there are extra precautions you need to be aware of. An advanced communication with your candidates, and make sure that if they're showing symptoms or have got symptoms, they stay at home and they notify you and the training centre as well. Now, the people need to bring their own PPE, how to enter and exit the site, and where to be. But also cater for the instructor being early. He has to prepare and he has to check you've got all the things in place. There's some advanced communications to be around. Make sure the candidates arrive early as well. There's nothing worse than candidates arriving late and holding up others. The classroom must be prepared in advance. Not on the morning, but prepared the day before. It should be deep cleaned, it should be sanitized. And if there's any extra spare PPE, just in case somebody's forgot some, that should be sanitized and cleaned as well. And markings on the floor to identify the 2 metre spacings and the transitions. And there is a need within the IPAF training for a group photograph. Make sure that can take place and keep enforcing the 2 metre social distancing. And make sure the classroom has lots of sanitisation stations in and around it as well. During the practical testing, obviously there's the 2 metre kind of social distancing to be enforced, whether that be in the training room, transitioning to the practical area, and even in the practical area. It should be marked where the candidates can stand to stay there 2 metres away. And sanitizer should be available with every machine that is being used, and candidates should sanitize before and after operating it. And candidates waiting should waiting to do the practical assessment or use the machines in predetermined designated areas at 2 metre spacing, so it's clearly marked where they should be. And again, PPE shouldn't be shared. Simple rules, if we abide by them, we can help reduce the risk. Instructors at the end of the day will receive completed forms, they'll check and exchange relevant information, and then it should be organised for candidates to leave safely. So, in summary, we're in unprecedented times, in uncharted waters. None of us have experienced this before, and there is going to be a new norm for a foreseeable future. We've got to be aware of the World Health Organization, government and industry guidance. We've got to follow logical hierarchy of control, and we've got to involve all parties. We've got to inform the workforce, have an informed workforce, but work with that informed workforce, work together. Enforce social distancing and practice good sanitisation practices, washing hands and cleaning of equipment and materials. We are all in this together, and only by working together can we reduce the risk of COVID-19 and stay safe. And one final thought: if an activity can't be undertaken safely, it shouldn't take place. We all have to look after each other, and safety is our first priority. So thank you for listening to the webinar. A reminder here that what IPAF's there to help and support you, not just with the training, but lots of other means and ways of helping you through this pandemic. We're giving advice. So thank you for listening to me, and I believe it leaves a very short time for a few questions and answers. So back over, I think, to Peter. Have you got any questions, Peter?
Yes, we've got quite a few questions published. We'll try and get through as many as we can in the next 5 minutes that we've got before we finish this webinar. Just an update on, Chris was talking about our e-learning platform. Just a bit of an update. We have seen a bit of an explosion during lockdown. The numbers of people conducting e-learning theory and MEWPs for managers training grew threefold during the lockdown period, as we now see companies coming out of lockdown and start training again, it's jumped even more to around 4 times the amount of people going through e-learning that were pre the restrictions. So that's fantastic, and we're looking at ways to continue to minimise social distancing through electronic theory tests, so people don't have to come into the classrooms at all in your training centres and can go straight to do the practical, which is probably a bit easier to organise. Right, let's get on with a few questions then. One from Gareth. Is it okay to use the machines, operate the machines, I assume, from out of the basket to aid social distancing, obviously with the right risk assessment method statement in place?
When do you mean using it from the ground controls while someone else is in the platform? I wouldn't advise that. I would advise that the person in the platform is trained and operates the platform, and they are the one who is in charge and control. They're near the work area, they're nearest to the hazards, they've got control of the machine. So as a general practice, I wouldn't suggest using the ground controls to manoeuvre somebody else in the air.
Okay, thank you. Another one. Why have you chosen not to recommend allocation to individual machine use to minimise cross-contamination?
I think if you look back, I did. When I was talking about isolating, I showed a slide and I showed 4 machines side by side, and I said, instead of parking them up like that, make sure your kind of people are restricted 1 machine per operator and they don't park them near together. So I hate to contradict you there, but I think I did mention that and cover that. But you're perfectly right. That is a good, safe practice to do and something that should be enforced.
There's another one around sort of the rental companies. If I receive a MEWP from a rental company, how can they demonstrate that they don't supply me a machine that's free of the virus?
Hopefully they will supply you a machine which is free of the virus, and that is by consulting, as I said earlier, with your rental company, checking their safe systems of work, checking their how they clean the machine. The majority of rental companies will pressure wash machines using detergents which kill the virus, and then they have work methods for cleaning them. And once they've prepared them, done the pre-delivery inspections, wipe down those touch point areas. So be assured, check with your rental company what procedures they've got in place, and to put your mind at ease. Don't just hire it from anybody. Just make sure you do your due diligence before you hire.
Thanks, Chris. There's another one. Chris is giving other guidance not documented in your guidance document. This is good stuff. Why isn't it documented for future reference? Well, it will be documented for future reference because this webinar will be saved. But Chris, you got any points on that?
Well, what I said right at the beginning was it complements and doesn't mirror the guidance document word for word. I felt when I was doing the presentation, it's very good guidance, but I wanted to expand on certain points. And if people have got this presentation to refer back to, it's a good guidance. They can refer to it. I believe some of the questions we don't get around to answering may be probably answered on and published as well. So it's a good reference document, the document to start with, but this is a reference as well. So yeah, that's kind of a bit extra. Doesn't help, does it? Or helps, doesn't it?
Yeah, no, thank you, Chris. I agree. Would IPAF update the pre-use checks to include sign-off that the MEWP has been sanitised? I'll let you answer on IPAF's behalf there, Chris. Not a problem.
That is between you and your rental company, and part of your it can be kind of, if you've checked their measures of what they do, and by getting the machine delivered, you can, if you're using the correct supplier, you can assure that it has a minimum risk of contamination.
Yeah, so, I think Chris covered it off in during the presentation. The machine needs sanitising, it needs cleaning regularly. So we would recommend that it is part of the daily checks at the moment until we've eliminated this thing 100%.
Yeah.
If you have to work closely for the 15 minutes advised, how much time must elapse before you can start working closely again? Sorry, Chris.
I would suggest you apply common sense. Talking to people who have actually done this 15 minutes together, when you're wearing kind of a face mask and other PPE, it can get quite hot, and you should plan to kind of a significant period. What that period is will depend on the importance of the activity, but common sense must prevail, and government guidance around that it kind of is there to help as well. But there isn't any specific kind of, you must now have 2 hours apart or whatever. It depends whether you're working indoors and outdoors, because outdoors there's less risk as well. So it depends on a lot of different circumstances, what activities, how close, and what other PPE and things you're using.
Okay, thank you. Thank you very much, Chris. That concludes our webinar. Thank you very much for attending. If we didn't get to your question, I apologise. As we said at the start, this will be available via a link on our website with the guidance document itself. So thank you very much for attending.
Thank you very much for listening, everybody, and stay safe.
And thank you to you, Chris. Thank you.
My pleasure.